This Medical Minute is brought to you by Bethesda North, a TriHealth hospital. Bethesda North is the first hospital in Greater Cincinnati and one of the first in the country to offer a new technology to treat atrial fibrillation. It's called CryoAblation. Dr. Gaurang Gandhi, co-medical director of electrophysiology at Bethesda North, explains the benefits.
So atrial fibrillation is one of the commonest cardiac conditions that we deal with on a daily basis. That's one of the number one reason people get to the hospital for emergency room admissions, into the hospital for prolonged admissions, as well as in the doctor's office and cardiologist. Usually when we do any ablation for arrhythmias, that's what I do. I'm an electrophysiologist and try to fix people's heart rhythm problems by destroying the extra connections in the heart, and usually use radio frequency. So the principle is the radio frequency touches the tissue, it heats up the tissue, and then the tissue desiccates, and that's how we get that extra connections killed completely and permanently cure the problem. Now when you heat up a tissue, there is always some collateral damage. Particularly surrounding tissues can also get the heat and can sometimes have problems. The cryoablation is the newer technology. It's been used on surgical side, and now we are going to use this in the newer technology in treating a specific kind of problem, which is atrial fibrillation. And what it does is, instead of heating the tissue, it freezes the tissue to minus 60, minus 70, or minus 80 degrees. And so what happens is, if you remember as a kid when we used to stick our tongue to the pole in cold winter, it sticks there. So the catheter sticks right at the spot where it is. And so it's very precise lesion. Second thing, when we cool the tissue, there is not so much collateral damage as we say, and so I think it will be more precise, less damaging, and better outcomes, as we already know from the trial that led to the approval by the FDA. We are the first in this whole region to have this technology available and ready to be used in our patients for treating paroxysmal atrial fibrillation. Everything in electrophysiology has evolved in the last 15 years, and we like to be at the leading front rather than the trailing front, and that's the tradition of Bethesda. It's the tradition that we want to follow.
This Medical Minute was brought to you by Bethesda North, a TriHealth hospital.